Be ready. 5 seconds. Start. Honorable Speaker, I rise today to address this august House on a subject of immense national importance, Ayushman Bharat. This flagship health initiative of our government has been a transformative force in ensuring that quality healthcare reaches the last mile, fulfilling our commitment to universal health coverage and social justice. Today, as we reflect on its impact, we must recognize the profound change it has brought to the lives of millions across our great nation. Ayushman Bharat, launched in 2018, is a historic step towards strengthening India's healthcare system. It embodies the vision of providing accessible, affordable, and quality healthcare to every citizen, especially the poor and vulnerable. This scheme operates on two pillars: the Health and Wellness Centers (HWCs) and the Pradhan Mantri Jan Arogya Yojana (PMJAY). These components work in synergy to address both preventive and curative aspects of healthcare, ensuring that no Indian is left behind in the quest for a healthier future. The health and wellness centers, numbering in the lakhs across the country, have redefined primary healthcare delivery. These centers are not just medical facilities but holistic health hubs that provide a range of essential services from maternal and child care to non-communicable disease screening, mental health counseling, and free essential medicines. The emphasis on preventive healthcare has significantly reduced the burden on secondary and tertiary care hospitals, ensuring that minor ailments do not escalate into serious health crises. More importantly, these centers have been a beacon of hope in rural and remote areas where access to medical facilities was once a distant dream. The second and perhaps the most widely recognized component of Ayushman Bharat is the Pradhan Mantri Jan Arogya Yojana, the world's largest government-funded health insurance scheme. With coverage of up to Rs 5 lakh per family per year, PMJAY has relieved millions from the crippling burden of healthcare expenses. In a country where out-of-pocket expenditure on healthcare has historically pushed many into poverty, this initiative has been a game changer. Families that once had to choose between health and financial survival now have the assurance that quality medical treatment is within their reach. One of the most remarkable aspects of PMJAY is its inclusivity. The scheme covers nearly 12 crore families, benefiting approximately 50 crore individuals, including the most vulnerable sections of society: migrant workers, daily wage laborers, street vendors, and those living below the poverty line. The seamless, cashless, and paperless nature of the scheme has ensured that beneficiaries receive treatment without bureaucratic hurdles. By partnering with both public and private hospitals, the government has expanded healthcare accessibility, ensuring that the best medical facilities are available to all, irrespective of their socio-economic background. The success of Ayushman Bharat can be gauged by the staggering numbers it has achieved. Since its inception, more than 5 crore hospital admissions have been facilitated under PMJAY, saving families from catastrophic health expenditures. The scheme has empowered patients by giving them access to advanced medical procedures, including major surgeries, cancer treatments, dialysis, and specialized care that was once beyond their financial means. It has also strengthened our healthcare infrastructure by incentivizing private hospitals to set up facilities in underserved regions, thus bridging the urban rural divide in medical services. The role of technology in the implementation of Ayushman Bharat has been commendable. The Ayushman Bharat digital mission, launched to create a seamless digital health ecosystem, is revolutionizing healthcare delivery. By linking hospitals, diagnostic centers, and patients through digital health IDs, the government is ensuring transparency, efficiency, and ease of access. The integration of artificial intelligence and big data analytics has further helped in early disease detection, efficient resource allocation, and better policy planning. Beyond infrastructure and financial aid, Ayushman Bharat has significantly impacted employment and medical education. The expansion of healthcare services has led to an increased demand for medical professionals, technicians, and support staff, generating employment opportunities across the country. The government's push for establishing new medical colleges and training institutes under this scheme is also addressing the shortage of doctors and healthcare workers, ensuring that India is better equipped to handle future health challenges. The COVID-19 pandemic was a litmus test for Ayushman Bharat, and the scheme stood resilient in the face of adversity. At a time when the world grappled with unprecedented health and economic crisis, PMJAY played a crucial role in providing free COVID-19 testing and treatment to millions. The scheme was instrumental in the rapid expansion of healthcare facilities, procurement of medical equipment, and financial assistance to hospitals battling the pandemic. The robust framework of Ayushman Bharat enabled India to navigate one of the most challenging times in modern history with resilience and determination. While we celebrate the achievements of Ayushman Bharat, it is imperative to acknowledge the challenges that remain. Expanding the reach of the scheme to ensure no eligible family is left out is a priority.